May is High Blood Pressure Education Month, and doctors at the University of Michigan Health West are raising awareness about the importance of keeping your blood pressure in check. Here to tell us more, Dr. Ronald Grifka. How are you?
Hi, well, Michelle, glad to be here, and I hope you're doing well today.
Yeah, I'm doing well, thank you. Okay, so tell us a little bit about the impact that high blood pressure can have on our overall health.
Sure. Well, high blood pressure or hypertension, has been called the silent killer. But in fact, sometimes it's really not so silent. We know that high blood pressure can cause heart disease, strokes, kidney problems, and even vision loss. And we look at in this country, there's probably, with the number of 130 over 80, there's over 120 million people who are diagnosed with hypertension. That's a lot of people. The cost to the country is about $130 billion a year between the healthcare costs and then the work lost, and even not even thinking about the time lost with family. So it's a huge problem in this country and around the world.
Yeah, it sure is. What are some of the risk factors that we should be looking at?
Well, certainly obesity is a problem. Diabetes is a problem. Smoking is a huge problem. Smoking makes your blood vessels real stiff, and that will shoot your blood pressure up very high, which then can lead to strokes and other problems. So a number of common things, we've heard them all before, but sometimes we don't pay maybe as much attention to them as we should.
And also, I feel like sometimes we think of this as older individuals having it, but anybody can have high blood pressure.
Certainly, kids, teenagers, young adults, and older people. Certainly, the older we get, the stiffer our blood vessels become, so it does become more common. But nonetheless, a number of younger people are getting it. Managing your stress effectively, a balanced diet, and again, something we've heard before, but reducing our salt intake. All of these are important measures to having a healthier lifestyle and having a lower blood pressure.
And those are all things that we should be doing before we turn to medication.
Absolutely. There's no question there. People, we see all kinds of advertisements and commercials for an easy cure for high blood pressure. Unfortunately, there is no easy cure. If there was, everybody would be buying it, be selling off the shelves faster than they could stock them, but there's just no really simple or easy cure. Kind of a lot of tried and true methods, as I said. Regular exercise. The studies showed that if you do 150 minutes a week, so really just 25 minutes a day, all we need to really help. Losing weight is helpful. Not smoking is helpful. Decreasing our salt intake. Many, many simple measures we can do that will very likely eliminate high blood pressure or make it much more manageable for our medications.
All right, getting control of your overall health. Well, Dr. Ronald Grifka, always great to see you. Great advice, as always.
Great, thank you, Michelle. Stay well.
You too, thanks.